Hello, you're watching McLaren Port Huron's Today's Health. I'm Barb Winters. On our program today, we're going to be talking with Infectious Disease Specialist Dr. John Brooks, and we're talking about hepatitis. Dr. Brooks, hepatitis is something that, I don't know, it seems like I never used to hear about it, and all of a sudden I'm hearing about it all the time. So what is hepatitis?
So hepatitis medically is an inflammation of the organ, the liver. So hepatitis does not have to be an infection. It can actually be caused by many different things. So the liver, when we sit and think about our basic functions, is the largest internal organ that we have, and its function is vast. It helps our immune system. It helps us certainly with our nutrition, helps us break down our food and store our sugar so we have energy, and it's basically the major decontamination plant in our body. It takes all those toxins and bad things of our body and breaks them down and gets rid of them. So the liver is an incredibly important organ, but because of the stuff that it does, when it's not functioning well, we can get quite sick. So hepatitis is an inflammation of the organ of the liver. So that's the technical term. Now, most of the time when we think about hepatitis, since I'm an infection guy, guess what? We think about the viral infections, and those are quite common.
Okay, so are there different types of viral infections?
So actually, yes. And in the world of infectious disease, we talk about it as alphabet soup. So when we talk about hepatitis, there's hepatitis A, hepatitis B, hepatitis C, hepatitis D, and it keeps on going all the way through K. So they've named them by the letters because of kind of how they were found and their genetics and what makes up each of the viruses.
Okay, so I'm just going to make the assumption that each of them is a little bit different, and so for clarity, let's talk about hepatitis A.
Let's start at the beginning.
This first. What causes it?
So hepatitis A is a viral infection. It's a virus, and the virus is unique in that it lives within our gut. It affects the liver, and it is easily transmitted from person to person by what's called the fecal-oral cycle. So that means that somebody sheds the virus in their stool, and if they don't do good hand hygiene after they're using the bathroom, then it's on their hands and they easily transmit it to other people by contacting, or most commonly by handling food. It gets onto the food and then it's ingested. The virus is quite resistant to the environment, so it doesn't dry out really quickly, and so it lives on stuff for a bit. So it's pretty easily transmitted once it's on a food product like lettuce, which is a common way that we'll do that, or fruits, and then that gets ingested and then we get the virus.
So this virus lives in everybody's gut, or people that are infected with hepatitis A?
People that are infected. So
okay.
It is one of those viruses that it does require a person as a host to make more of itself, but then it's easily transmitted to other people, again, through this fecal-oral cycle.
So how common is hepatitis A?
So in the United States, it's not as common as other parts of the world because our sanitation is better. We do have much more access to hand hygiene, washing the hands, alcohol-based hand cleaners, and in our society in general, we're a little better than if we think about the third world. If you think about parts of the world that don't have running water, where they don't have bathrooms, so it's much more difficult to contain an infection that is spread through the stool than it is here. So it is less common. So we think about 25,000 or so cases in the United States on a yearly basis.
Are there symptoms from hepatitis A?
So hepatitis, in general, if you had hepatitis A, B, or C, which are the three most common hepatitis in the United States, it's actually difficult to tell the difference clinically or by symptoms when somebody first gets them, because the viruses are doing about the same thing. They're inflaming the liver. So an inflamed liver will make you have a fever. You'll have malaise and fatigue. You won't feel well. You usually get a lot of tiredness. That's a pretty common thing. And as the infection progresses, we can get jaundice, which is yellowing of the skin and the eyes. And that's actually, as we've been infected for a bit longer, one of the symptoms that happens.
Are there always symptoms with hepatitis A?
So all hepatitis are going to have symptoms, but there's always a gradation, or some people have mild, some people have more severe disease. And again, it goes back to we as human beings. Young, healthy people tend to have less symptoms than older, sicker people, and that happens to be the case also with hepatitis A, B, or C. The healthier the person, the less troubles that they have. So hepatitis A, right now we've been hearing about it in the news. There has been an epidemic in southeastern Michigan, started in August of 2016, and there have been many hundreds of people that have become infected. So St. Clair County, we've had about 30 cases, and all 30 have been actually hospitalized. So it does create a bit more of a problem in the current outbreak that we're having.
That's really interesting. So you must be able to spread it without having any symptoms.
So the answer is yes and no. when you have a low-grade temperature, you feel a little achy, it's pretty nondescript symptoms, and so people will have that. They go to work in their restaurant, they go to work at the factory, they go to work at the hospital, because they have just mild symptoms. It's not enough to keep them home and sick and in bed, so they're actually get out there and they're functioning, because we've got to work, and so that gets people out and moving in the society.
And but then there's that second piece. You have to have poor hand hygiene or something to be able to spread this virus.
So when we look at our world, we'll talk about here, let's talk about St. Clair County. How many active restaurants do we have in our county, right? It's almost not countable, right?
Right.
So we utilize outside food service for a lot of what we eat. And so there becomes a risk, because then we have people that prepare food, one person for lots of people, and if that person gets hepatitis A, they can easily transmit it to lots of others if there's a break in hand hygiene. And that's actually what we've seen pretty consistently here in southeastern Michigan, is that we can almost always go back to either a restaurant worker or somebody that's somehow dealing with the public as being able to spread it through.
How do you treat hepatitis A?
So hepatitis A, so let's say right now Barb gets hepatitis A. So there's a couple of things we can do. If we know that your symptoms have just started, we can give you a vaccine. There's an actual hepatitis A vaccine, and if we give you that, it'll prevent you from getting very sick. Now, the other thing that we can do is that, let's say we really don't know when you got it. We don't know when you've acquired the virus. We really have no clue. We actually can give you antibodies from other people. That's called passive immunity. And it's an immunoglobulin vaccine, basically, that we can give you that will actually turn on your own immune system and protect you from other people, because we've given you their antibodies already.
Is there a vaccine? Can everybody be tested for hepatitis A?
So hepatitis A is easy to test for by a blood test, and yes, it's very easy to test for. It's an inexpensive blood test, and it can be checked for. Now, what I can tell you that's different between you and I is that when we were kids, there weren't the vaccines. So people that are now under the age of 25, if they got their routine vaccines, they've been vaccinated against hepatitis A and B. It became part of the standard routine virus vaccine series that we've been giving the kids now for a quarter century. Because we've been able to have that technology.
But we don't do routine screening of all adults. We don't. If I ask somebody what's the recommended screening for age 35,
there would be nothing for hepatitis A or B or C, correct?
Okay, all right. So this isn't something we routinely screen and vaccinate for.
Well, we do vaccinate for especially all young people now.
Okay, yes.
Will be vaccinated. And now with that there's an epidemic, we have the opportunity here in St. Clair County, the health department on their website, they do have clinics. You can go get your vaccine there. And of course all the healthcare workers in the community have the opportunity to get vaccinated so that we can protect ourselves and prevent transmission when people come to the hospital.
Are there health risks if you get hepatitis A and are untreated?
So the answer is hepatitis A can cause inflammation of the liver. And the inflammation of the liver can be mild, moderate, or severe. So mild disease, people just feel maybe like they have a cold even, just feel punky, don't feel great. More moderate disease, they may have difficulty eating and ingesting food because their liver's not working right. And the very serious hepatitis A that can occur, now that's rare. Less than 1% of all hepatitis A ends up in serious disease. The liver can actually fail, and people can actually go on and have death. Now that's not common, but it can occur. But because that can happen, that's why all young people now are vaccinated for hepatitis A and B.
Okay. Well, we're going to take a break and come back and talk about hepatitis B.